Hello everyone. I am Ayindri Banerjee. I lead a AI team for a major healthcare company. We specialize in Medicare and focused on senior home healthcare. So today's presentation is going to be around how we are using AI-enabled tools to make home health post-acute care even better. So um, I'll be talking to you. I'm coming to you from Boston, and I'm excited about the NLP Healthcare Summit. And with that, I want to focus on what is home health and why post-acute care is important, and how leveraging the power of generative AI and data-driven preventative care path can really save lives. So with that, let's begin. So for today's agenda, I'll be going over, for those who are, not very familiar with healthcare, I'll be talking about a high level background of healthcare and where does home healthcare fit in. And what is home healthcare? Like before I joined my current company, I was actually not very familiar with what home healthcare really meant, even though I did see my dad receiving home healthcare back in India. So I'll be going over a little bit of what that means and what are the key components. After that, I'll be going over what is a home healthcare agency, how do they really operate, and why is wound care so important? And with that, I will introduce the prototype that we have developed, which is Home Heal. And it's a home healthcare AI assistant which helps handle wound care. Home healthcare is a crucial part of US healthcare, offering medical care and support services to patients at home. It impacts the most vulnerable population who are probably recovering from a long-term acute care or any inpatient admission, or they may be having some chronic medical conditions which needs to be managed at home. Usually, many times home health care is followed by a surgery or some other kind of illness which is chronic. With COVID, after post-pandemic, importance of home health care became, it became much more important and crucial to healthcare. It has many benefits, of course, when a doctor comes to you, there are many efficiencies we can gain from a quality of care perspective. So with that, I will also talk about something called value-based healthcare and why is this important. In general, in healthcare, there is a movement towards from fee-for-service to value-based care. All of it is basically so that we are valuing the outcome more than the volume of services that's provided. So with this, there is always a renewed focus on what kind of quality of care can we provide so that that can prevent hospital readmission after discharge. So that's a key metric that we follow. So it's not just about cost, but it's also about the quality of care, which is very important. And that's where some of the contracting and the provider incentives, etc., are determined about around how the entire quality of care was delivered. So that's what we call value-based care. And of course, there are many components here. You have the patient that you have the post-acute alignment. You have hospitals, physicians, health plans. So everybody comes together to deliver a value-based healthcare network. What I'm focusing today is around the post-acute alignment. How can post-acute care be more efficient, or how can it be delivered better so that we don't have hospital readmissions again? Some of the key numbers that I wanted to bring in, it's a significant amount, and obviously the healthcare industries, the total healthcare spent is pretty large, home healthcare is a significant amount of that. And wound of all of the various kinds of home healthcare episodes, episodic, if we talk about home healthcare, can be episodic, or they can have different other types of care arrangements. But specifically for episodic care, there will be wound care is one of the highest, most expensive and most difficult, because it is also affects the most vulnerable part of the healthcare population. So the way home health is delivered, right? We are all familiar with the healthcare system, where there's this, you have the PCP's office, and then there you have the hospitals. But home healthcare is something that not all of us are aware of, right? So the way an agency operates is they operate in different states, and they take care of a certain population which is geographically proximate, because usually a home healthcare agency will have uh, the care team, maybe nurses, physical therapists, OT, and speech therapist, home health aides. So whatever their team is, they are able to handle. They decide staff based on the population around that area and how much they can handle. So usually they will have a referral, which will lead to an admission, which may or may not lead to an admission. But from admission, usually a healthcare episode is maybe 30 days, 60 days, and there is start of care, there is intake, and within the window of 60 or 30 days, the care is delivered, whether maybe they need a skilled nursing facility, and then maybe after a week they need a physical therapist. So different, depending upon the different conditions that the patient is coming transitioning from an inpatient care, it's determined what kind of how many skilled nursing facility visits are needed, how many physical therapist visits are needed, etc. So overall, there are a lot of dynamics in a home healthcare agency, which involves, at the end of the day, the goal is to make the patient healthier, and as many tools as we can provide them, especially for the nurses who are taking care of our members, our patients, the better it is. So preventative care with AI is something that we are all exploring, and this is a very promising area because there is not enough done, but we are just getting started. So usually, there will be an institutional referral from either an inpatient facility, or there might be a PCP where the physician or the patient went to, and they had a medical condition that triggers a home health care admission. Now here, in home health care, we obviously try to provide as many tools where we can predict, like if a patient's condition, based on their medical history, they have higher likelihood of an inpatient admission, we provide that information more readily to the care team than we used to before, so they can then take action at the right time when they are in the patient's home. Another area, which is AI-driven care plan optimization, that actually is a newer area, and this is where our current approach that I'm going to share today is mostly focused on, where when nurses go to the patient's home, uh, patient can have various kinds of wound stages, and various kind of they could be diabetes related, or they could have some vascular disease, and their ulcers could be pressure ulcer, or some various kind of conditions. So it's quite complicated, the matrix of what really is needed to provide home wound care at home. So an AI driven care plan can go a long way in helping nurses handle it in a high pressure situation, just to as an added augmented assistant. So as is, it's a uh, evident probably. Hospital readmission is something that we want to avoid, and we want to create optimum care paths and care strengths so that patients are healthy. So that's the goal of whatever we are trying to do, whether be it predictive models or AI driven care plans. And the AI driven agent can feed off of the predictive models. So that's the, it's not exclusive to each other. So in general, for now, the traditional approach has been around predicting what kind of medical condition and patient demographics can lead to higher inpatient admission risk. So this has been the traditional approach, and it continues. And as more volume of data starts increasing, other than claims, home healthcare also has some encounter data, some other data whenever a nurse practitioner visits home health. So we are still, working on creating different kinds of predictive models to prevent readmission. But other than that, what also we did is we looked at the sequence of if there is an episode, how many what is the sequence of care. Like, obviously there are, you need skilled nursing facility, you need physical therapy, you need various other intensity of those services. In the middle, you need to wait for maybe a week, right, or a couple of days based on the intensity of the wound. What kind of care paths leads to a more optimal outcome? So whether the patient got healthier or they had an inpatient admission. So in addition to predictive modeling, what we also did is what are those optimum sequence of care. And as you see, some of the unique things that we've done is used um, a way of calculating similarity between the care sequences. And out of all our claims, we were able to say, okay, out of all of that, for this wound care, maybe there are 12 types of care paths. So that's also goes into what we do after that. So the result is basically personalized care path, right? You feed in all these predictive models and the care sequence, care path that are optimum, and we kind of calculate the probability of what should be the next best action for this particular patient to have a healthy outcome, right? So you marry all of that and create this proprietary data driven data set, which is going to help us go through the next steps in an optimal way. That's where, with the power of, so all of this, like data driven optimum pathways, I've been discussing that. But on top of that, right, nurses also look at a lot of medical literature, and with the new development of generative AI and chatbot, all of this, when it comes together, that's when what we are calling home heal, an AI enabled personalized home health wound care planner comes in. um, what this does, it basically has this data integration layer, where we have this medical history, wound assessment data capture, comorbidity analysis, historical response tracking. With that, we have an AI engine which is going through the literature. It's understanding patterns from outcomes, risk prediction modeling, care sequence optimization. This is all folded into the AI analysis engine. Now these, when they combine, then it becomes this care plan generator, which is a personalized care sequencing, skilled nursing visit optimization, PTOT and home health needs assessment, and adaptive planning based on healing. Of course, right now, even though we have this provider interface is really a chatbot, it's kind of in the roadmap how it can be integrated with their in-home devices. The key benefits, of course, is the evidence-based sequencing, risk readmission, risk reduction, and personalized resource allocation. Because usually the resource allocation is done either at the state level or the branch level or the region level, right? But when it comes down to patient level, that's when the real value is, and that's where generative AI comes in as well. um, Well, this is basically pretty much whatever I talked about, but in a flow manner. You have patient data, medical literature, you have internal DB. We create this data processing layer, and which feeds into the AI analysis engine that's able to risk stratify, do a care sequence optimization and treatment protocol selection, which then generates a care plan. And you have a provider interface and a patient interface, and the feedback loop goes in. From a system architecture, this is what it looks like. We have a front end where we did chat module, and I'm going to demo that. There is a back end, which some of it is we haven't integrated it, but in general, this is what the service looks like. And you have the AI layer where I have the knowledge base, the care generator, and the NLP engine, which all of this comes together to deliver home heal. So time for a little demo. If you've enjoyed the presentation till so far. Now here's what the interface looks like. Of course, we could have right now. It's basically a chatbot, which is where you enter the various different inputs. For example, you can have a wound stage based on the different stages: stage 3, stage 4, etc. Wound location, wound size, how much is sometimes this is an amount from a clinical perspective that is required to understand what kind of treatment they need. And you can also add in complication, whether you have just diabetes or malnutrition or both, right? And then we generate a care plan. Once we do that, it basically the assistant goes and looks at all of that, and based on the patient's information, it's going to produce that. With that, let me just show you a little demo where you can enter the age here. You can enter what kind of ulcer they have, what's the stage, where's the wound location, um, wound size. All right. Complication, diabetes, you can have comorbidities, and then generate care plan. What it does is it basically goes through the literature and finds the relevant information. And along with it, what we are working on is we also have internal information on what the patient's risk category is, what kind of, if they have a high inpatient admission risk, then what additional information can we provide for the particular nurse to handle that. So that's basically it. Path forward is we are in the process of scaling the RAG and vector DB for tuning the RAG and scaling the vector DB for the medical literature. Also scaling the NLP service that we are going to be using for all the text summarization and building responses from different data sources. This is obviously right now the interface that I have demoed to you is you have to literally enter the age and everything else information. But the ideal state will be when all of this will be fed directly from the home healthcare delivery application into this assistant. So the patient doesn't even have the nurse practitioner or whoever the home healthcare delivery personnel, the team is, they don't have to enter that. They just have to enter the patient's information, the name or whatever ID, etc. And all the information will be self-fed into that assistant. And this obviously we will keep optimizing the data driven, finding optimum care and utilization recommendation based on current care patterns, and etc. etc. So with that, that's the path forward. Hope you enjoyed this presentation, and I'm looking forward to next year. And thank you for attending the healthcare NLP Summit, and hope you enjoyed this presentation. And if you need to connect to me, you can connect to me on LinkedIn. And again, I am Ayindri Banerjee, and I was very excited to present today's solution, which uses generative AI and data-driven outcomes to save lives. Thank you again.